welcome back to the Boober channel. Today we are taking a deep dive into what it means when your baby is in the breech position, which is butt first rather than head down. And as you are approaching your due date, you may have a lot of questions. Maybe your midwife or doctor has been saying, "Ooh, your baby's still breech, and what does that mean?" So if you're new here, please don't forget to subscribe for more expectant and new parenting tips and tricks along the way. And please remember, as always, this video is only for informational purposes, and please contact your healthcare provider about any of the things we might be discussing today if you're trying to turn your breech baby head down. So what is the breech position in the first place? Breech is what we call it when your baby is either butt down or knees down, or there's something called footling breech where the foot is kind of hanging down. There's lots of variations on the breech position, but ultimately, why do we care about this? Well, turning a breech baby can increase the chances of having a vaginal birth, reducing the need for cesarean birth, and enhancing postnatal outcomes. The breech delivery position needs to be done by a very skilled and experienced midwife or doctor, and we just unfortunately don't have too many of those people anymore who can do that in the US, or people who have even been trained. So if you don't have a practitioner who's very skilled and able to do this, or they're not mandated or allowed to do this by their healthcare facility, it's not going to be an option for you. And while people throughout all of time have given birth in the breech position or with their baby in the breech position, it is a more complicated delivery that requires a more skilled attendant, also because the baby is, rather than going head down, where they use the largest part of their body to open up the birth canal and then the rest of the body follows through more easily. When the baby is butt first or presenting with the smaller part, then that part of the body comes out and then we have to manage and deliver the head. So there can be other complications related to the breech delivery. Here, if you're watching this, you're probably thinking, well, if you really want to have a vaginal birth, you know that most likely you're going to have to get that baby to go into what we call the head down or the vertex position. And once we get that baby into that position, then in most cases you'll be cleared to go ahead and have a vaginal or birth canal birth. So what factors are related to breech presentation? Well, it turns out that there is an increased risk of breech presentation if you've been pregnant before. If you have twins or triplets or more, then there is a greater likelihood of having one baby be in a breech position. Sometimes with too much or too little amniotic fluid, we can see that happening. Sometimes the uterus has a varied shape, or might have a fibroid, might have a bicornate shape, so that can influence it. Sometimes if the placenta previa is happening, placenta is covering part of the lower, the cervix, or finally if the fetus is preterm. So all of those things can be factors, but other reasons why we might have a breech presentation may be that I have a lot of torque in my pelvis or tension in my pelvis, legs, ligaments that are connecting the uterus to the area, and that can all cause me to not have quite enough room in my pelvic area or in my uterus for the baby to settle into their head down position. So what are some different things we can do to turn the baby, or try to get that baby to choose a head down position from breech? We can try various physical positioning. Physical positioning could include the breech tilt, and that's where you're going to really elevate your hips up above your head using pillows or off the edge of a couch, or maybe you even heard about using an ironing board and balancing that against the couch and laying upside down for about 10 to 15 minutes or so, maybe 2 to 3 times a day. It's not super comfortable. It's rather hard to stay in that position. And the idea, though, is that we're trying to get that baby to kind of come up out of the pelvis and make a little more space to rotate around. There's also things called the knee chest exercise or position, and that's where we are almost in child's pose, but then we put our butt up in the air, and that's again doing the same thing. It's kind of getting gravity to act differently on us. We're upside down almost. The baby can kind of shift out, and maybe when you stand back up, baby goes down into a head position. Then we can go into really more of what we call the forward leaning inversion, where you're actually going to be on the edge of your bed or your couch, and your knees are on your bed or your couch, and then you lower your chest down to the floor so you're quite tilted, and that can really help you relax your pelvic muscles, and that might work. So there's a lot of physical exercises. Another thing that might fall into the physical category is actually getting into a swimming pool if you have access to that, which not everybody does. Doing handstands in the pool, and then kind of doing flips and somersaults and circles. I found a YMCA in my neighborhood where I could go try to do that when my daughter was breech, and I did lots of flips in the pool. But that is one of the things that you can do. What are some alternative or other techniques we can use to turn a baby? Some are studied, some aren't. I would say most of these alternative techniques are not really studied, but lots of people try them. And in fact, one of them was the thing that worked for me. So you can use hot and cold packs. A lot of people go with cold, like literally frozen peas or something like that at the top of your uterus, the top of the fundus, and then you kind of move it a little bit. And often when you put that cold at the top, and then some people even like to put warm, like a warm compress or a warm pack down in their lower cervix area, crotch, down pelvis, that the baby turns away. They turn their head away from the cold and they move toward the warm. So that's something you could try. Some people use sound therapy. So you might have your partner or you might have some kind of music, a music player that you put near, again, down near the crotch, down where you want the baby to go, down near your pelvic bone, and or you have your partner literally start talking. We call it talk to the crotch. It's very, very, they just get in there and they start talking, and that your baby may move toward your friend or partner's voice to be like, what is that sound? So that's another thing that you can do. Some people will start with the music or the sound up at the top by the head and then slowly move their voice or move the sound down, 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 down. So that can work. And then you can also try the flashlight technique, which is what I think really worked for me. You basically hold the flashlight at the top of your belly where your baby's head is, and then you slowly kind of move it down. You slowly slide down, 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 down toward the crotch. And when I did that, my daughter just went wild. She was moving so much. She really went wild. And the next day when I went to my midwife appointment, she was finally head down. And my daughter stayed breech until almost 38 weeks. So just wanted to throw that out there. We can also use complementary care therapies such as chiropractic technique and or acupuncture, or both. If you go with chiropractic care, you want to make sure that you're working with somebody who specifically works with pregnant people, so a prenatal chiropractor who is skilled and educated in what's called the Webster technique. Now, the Webster technique doesn't technically make the baby turn right then. What it does is it creates much more space in the pelvic area so that the baby can move in the uterus and will move into that what we call the optimal head down position. The chiropractor will use specific adjustments to the sacrum to help facilitate pelvic balance and improve conditions for the baby to turn naturally. What the chiropractor is doing is they're adjusting the sacrum, but they're also doing this kind of soft tissue manipulation, which includes the muscles, the ligaments that support the uterus. The adjustments are intended to balance the pelvic muscles and the ligaments, which really reduces the torsion or torque, or that's the best way to say it, in the uterus, which creates a more hospitable environment for the baby to turn naturally. I remember when I did this technique to try and get my baby to turn breech, it was really quite intense. They're really pressing down in the ligaments, and I was breathing through it in addition to some of the manipulations. But even though I don't know if it actually turned my baby to head down, like I said, I think the flashlight technique is the one that worked for me. It did make my body feel much more comfortable. And we know that going to a prenatal chiropractor can truly enhance your pregnancy so much. So even if your baby is head down, I highly recommend chiropractic care. It just can get rid of a lot of aches and pains, help us feel more balanced, help us walk better, help our lower backs, upper backs, body just feel a lot better. Another great technique with a ton of research and success rates is acupuncture and moxibustion. Acupuncture and moxibustion are traditional Chinese medicine techniques which have been used for centuries to address various health issues, especially pregnancy-related conditions. And these techniques are really well suited and noted for helping babies rotate down into the head down position, but also for a host of other things when you're pregnant, from nausea to low energy to body position and general aches and pains. So I can't really recommend acupuncture enough. Acupuncture, if you're not familiar with it, it involves the insertion of fine needles into specific points into the body to balance the body's energy, or what's known as qi. So as I mentioned before, it can also really help with other things. Super promotes relaxation, reduces stress. For breech babies, there are specific acupuncture points that are used to stimulate the uterus and encourage fetal activity, which helps the baby rotate to that head down position. Now, most commonly, what people do with acupuncture when they're trying to turn their baby from breech to head down is they actually use moxibustion. And moxibustion is specifically burning an herb over the left toe. It sounds kind of wild if you haven't done this before. It's a small spongy herb called mugwort, and you can hold it over. You can buy a stick of mugwort called a moxa stick, or the herb is called moxa, and that's why it's called moxibustion. And you will burn it over the left pinky toe in a specific point, which has a technical name, but since you are probably not an acupuncturist, we don't need to go into that. But the heat from the moxibustion is believed to stimulate that point effectively, increase fetal activity, stimulate the uterus, and encourage the baby to turn into a head down position. So typically you will burn the herb over the toe for anywhere from a few minutes to 10 to 20 minutes, and there are many studies that suggest that moxibustion, when combined with either acupuncture and or postural techniques, can be very effective in turning breech babies, particularly when used between 32 and 36 weeks of gestation. So you're going to want to make sure, of course, that your acupuncturist specializes in prenatal care. You can talk to your care provider about whether that is right for you. And once you're taught by your acupuncturist, you can actually go home and burn the herb moxa over your left toe by yourself. They'll show you exactly how to do that. Let's now look at massage techniques for turning a breech baby into the head down or vertex position. Of course, the general benefits of prenatal massage, can't say enough, but stress reduction, improved circulation, pain relief for those body aches and pains just feels awesome. So highly encouraged. But if you are experiencing a breech baby, there are specific acupressure points that they might do on your body, but there are also specific techniques that are known to work well, such as myofascial release, which is a therapeutic technique used during pregnancy to deal with various discomforts, but also helping with breech presentations. What happens is the technique focuses on releasing restrictions within the fascia, which is the connective tissue surrounding muscles and organs. So practitioners will use a gentle, sustained pressure on soft tissue to help eliminate pain and restore motion. And for pregnant people, this can really help address asymmetries and tightness in the abdomen or pelvis that might be preventing the baby from turning head down. So that's similar in the sense of what you might do at the chiropractor with the Webster technique as well, right? The idea is that there's tightness, there's torsion, there's twisting. How can we release all of those ligaments, muscles, bones, etc., so that everything opens up and relaxes a bit more, and now your baby can move into that head down position. Finally, let's talk about the clinical last option that most people use kind of after they've tried some of the physical techniques like acupuncturist or chiropractor or massage, after they've done positioning on their own like the breech tilt, or gotten into the open knee chest position, or used active release technique, right? Or this medical technique might be used after you use all of the other techniques, like getting in the pool and doing handstands, or using the flashlight to move light down and hope that the baby will turn. If none of those varying techniques work for you and your baby is still breech and you're moving closer to you're almost in your due window at the 37-week mark, then a lot of practitioners will suggest an ECV, or external cephalic version. And what that means is basically it's a technique where your care provider will manually move the baby from the outside and try to get the baby to rotate down into a head down position. It's typically performed in a hospital setting where immediate access to emergency care is available, should it be needed. It's rarely needed, but occasionally it can trigger labor or sometimes cause water to break or various other things that might happen. Or if baby's heart rate should suddenly drop when we move the baby significantly, it's possible that they do not appreciate that position and we will need care at that point. So, before the procedure is done, typically they'll use an ultrasound to check the baby's position, although of course we can check with the hands, but not all people still have that skill. And when they're doing this, this level of manual movement, they will often use ultrasound to check and confirm the baby's position, the location of the placenta, and how much amniotic fluid is there, or at least an estimate. Some people like to give a medication to relax the uterus and minimize discomfort. There are some people who offer an epidural or even require this. There's others who give it as a choice. It's certainly up to you, although it does depend on the practitioner you're working with, what they're comfortable with. Once you are, ready for this, you'll be laying down on your back. They place their hands on your lower abdomen. They locate that butt, and they use gentle but firm pressure, and they're really trying to kind of get the baby to shift around. They're going to heart rate monitor throughout the entire thing to make sure that the baby's heart rate or the baby does not go into distress. ECV, the last studies done on it, has a success rate of about 58% in turning the baby from breech to head down. It's generally considered safe, although it does include discomfort for people. There can be minor bleeding, and it can sometimes trigger labor. And so, if any complications do arise, they either just stop immediately, and then, if your baby hasn't turned yet, again, then you're still carrying a baby in breech. Or if it works and the baby goes head down, great. Some babies will rotate back on their own to that breech position, so they are going to check you again when you go into labor. But if it does work, then that can be great. And if it doesn't work, then you're going to be discussing your next options. Is it a planned cesarean delivery, or maybe a vaginal breech birth is possible? Maybe not with that practitioner, though. There are people who do go on to choose vaginal breech birth, but they do need to find a new midwife or doctor who is skilled and regularly attends such births. So that's the more medical version of what happens if none of the other technique works. You can go and try an ECV if your provider will offer that. So I hope this video was helpful to you if you're trying to figure out how to turn your breech baby, or maybe you're a doula and you have a client who has to try to figure out or wants to figure out how to turn their baby head down. So thank you so much for watching. Don't forget to subscribe for more updates and tips to help you throughout your pregnancy journey.